Have you ever wondered why some people develop type 2 diabetes while others don't, despite having similar lifestyles or weight? Or maybe you've just heard the phrase insulin resistance tossed around on social media or in health articles and you're left thinking, is that me? Is it the same as diabetes, or is it something I need to worry about even though my blood glucose is normal? Well, I'm Dr. Nerys Frater. I'm an NHS GP and founder of the Lifestyle Clinic, and I've spent years helping people untangle the confusion around blood sugar, weight and long-term health. If you've ever felt like you're piecing together a puzzle with missing pieces, wondering why you're tired, you're gaining weight, or being told to get healthier, with no real explanation, well, you're in the right place, because today I want to clear up one of the biggest misunderstandings, which is the difference between insulin resistance and type 2 diabetes, why it matters, from those with fully established type 2 diabetes to those with normal blood sugar but are overweight or have a family history of the condition. Insulin resistance matters long before you ever get a diagnosis. Knowing the difference now could change the way you approach your health for good. So let's get right into it. Because you see, most people think diabetes is the very start of the problem, but the real story begins much earlier and often is completely silent. Insulin resistance is the hidden engine quietly running in the background, sometimes for years. It's there before the blood glucose even tips into that danger zone. And here's the twist. You can have insulin resistance without diabetes. But you can't have true type 2 diabetes without insulin resistance first. Let's zoom out for a moment and look at the bigger picture. This is the health and disease curve, and so many people don't get to understand this properly. So imagine a spectrum, a long, gentle slope that starts with vibrant health on one end and ends with type 2 diabetes on the other. Most people think diabetes is a switch that suddenly flips on, but the truth is it's a slow, silent journey that's happened over years and even decades. On the healthy end of the curve, your body responds beautifully to insulin. When you eat, insulin acts as a key unlocking your cells so sugar can move out of your bloodstream and into your muscles or wherever for energy. Your blood sugar stays stable, your energy is good, and your body feels balanced. But as you move along this curve, often without any warning, you enter a phase called hyperinsulinemia. Here your body starts to need more and more insulin to keep your blood sugar in check. You might not notice anything at first, but behind the scenes your pancreas is working overtime, pumping out extra insulin just to keep things looking normal on your blood tests. As this continues, your cells start to ignore insulin signal. It's like the key is getting a little rusty and the lock isn't opening as easily. This is insulin resistance. Your body keeps turning up that volume, producing even more insulin, but your cells just won't listen. It's silent, but it's powerful, causing weight gain around the middle, fatigue after meals, sugar cravings, and creeping blood pressure, creeping up cholesterol, long before your blood sugar even tips into that danger zone. And if nothing changes, your pancreas eventually gets tired. It can't keep up with the demand. That's when your blood glucose starts to rise, first into pre-diabetes, where you might get a warning from your GP, but often still feel perfectly fine, and then finally onto type 2 diabetes, when the system is struggling to cope. But here's the thing, you don't wake up one day with type 2 diabetes. It's a journey along this curve, and you can step in and make changes at any point. The earlier you spot the warning signs, the more power you have to turn things around. And this is why insulin resistance is so important to understand, even if you've never been told you have diabetes. It's the silent engine driving so many modern health problems. Weight gain, high blood pressure, fatty liver, even heart disease and dementia. Addressing insulin resistance isn't just about blood sugar. It's about protecting your whole body, your energy, and your future health. So why don't most people, or even most doctors, talk about this curve? Well, the truth is, in medicine, we're trained to spot problems once they show up in the blood test, once you've already slid far along that curve. There's no diagnosis for insulin resistance, no quick prescription, and no tick box on that computer. So that means that the early warning signs are often overlooked, and most people don't get any real help until they're already in trouble. So if you're watching this, you're probably wondering, where am I on this curve? Is it already too late? Or can I do something now to protect my health, even if my blood glucose is still in the normal range? Well, I want you to know it is never too late. Whether you're at the start, somewhere in the middle, or already living with type 2 diabetes, you can make changes that move you back towards that curve towards health. And it doesn't have to be complicated or extreme. So let's break down what insulin resistance really is, how it's different from diabetes, how you can spot the early signs in yourself, and most importantly, how you can start to shift your body back down towards vibrant health, one step at a time. So insulin is an important hormone with many roles. Every time you eat, especially foods rich in carbohydrates like bread, rice, pasta or potatoes, or sugary snacks, your blood sugar rises. Insulin's job is to sweep that sugar out of your bloodstream and guide it into your cells, where it can be used for energy or stored for later. When everything's working well, it's a beautifully balanced system. But here's where things start to shift along that health and disease curve. If your diet is heavy on those quick release carbs and sugar, your body has to call on insulin again and again, meal after meal, day after day. This means you need a huge amount of insulin. Insulin is a fat storage hormone, so it fills up those fat cells. The problem is that over time, your cells stop listening. They become resistant to insulin signal. It's like insulin is knocking at the door, but the cells inside are ignoring the knock. At first, your body compensates by making more insulin. So your pancreas works overtime to keep your blood glucose within that healthy range. You might feel fine, and your blood tests might look normal, but underneath, your insulin levels are rising, sometimes 2, 3, even 5 times higher than what's truly healthy. And this is the stage of hyperinsulinemia, and it can go on for years without you even noticing. During this phase, you might start to notice subtle changes. You might be gaining weight, especially around the middle, even if you're not eating any more or anything different. You might feel tired after meals or need an afternoon nap just to get through the day. You crave sweets or starchy foods, sometimes even after you've just eaten, and your blood pressure or cholesterol starts to creep up. And maybe your doctor even mentions borderline results or fatty liver. You might even feel more anxious, have trouble sleeping, or notice your memory isn't as sharp. All of these are early warning signs that you're moving along that curve, away from health towards insulin resistance. But because your blood glucose is still normal, it's easy for both you and your doctor to miss what's really going on. And eventually, if nothing changes, your pancreas starts to struggle. It can't keep up with a constant demand for more insulin. That's when your blood sugar starts to rise, first into that pre-diabetes range, and if the process continues, into type 2 diabetes. But by the time you get that diagnosis, this process has often been at work for 5, 10, or even 20 years. Now here's the crucial point. You can actually move back down that curve. The earlier you catch insulin resistance, the easier it is. But even if you've been living with type 2 diabetes, you can absolutely improve your body's response to insulin and reduce your risk of complications. I've seen it happen to hundreds of people in my clinic. You might be wondering, why didn't anyone tell me this before? The reality is, in mainstream medicine, we're trained to look for high blood sugar and not high insulin. There's no routine test for insulin resistance in most GP surgeries, no blood test for insulin, not one that's reliable anyway. There's also no tablets for it, and because there's no specific prescriptions, it often goes unmentioned until your blood glucose tips over and you get that label of diabetes. But here's the empowering part. Understanding this curve gives you back control. You don't have to wait for a diagnosis to start making changes. In fact, the best time to act is before diabetes even develops, when the body is still flexible and responsive. But let's clarify something that causes a lot of confusion: the difference between type 1 and type 2 diabetes, because they are completely different conditions. In type 1, the body's immune system attacks the pancreas, so it can't make insulin at all. People with type 1 need to inject insulin to survive. Insulin resistance isn't the main problem here. It's the lack of insulin. Type 2 diabetes, on the other hand, is all about having too much insulin for too long. The cells have stopped listening, the pancreas gets worn out, and blood glucose rises. This is why type 2 diabetes is sometimes called a disease of overload rather than deficiency. And here's another reason why insulin resistance matters, even if you never developed diabetes. High insulin levels drive inflammation throughout your body. They can raise your blood pressure, raise your bad cholesterol, increase your risk of heart attack and strokes. and of course contribute to conditions like fatty liver and even certain types of dementia. It's not just about blood sugar, it's about your entire health picture. So how do you know if you might have insulin resistance? It's not always obvious, but actually there are patterns. The first and the most important one is that you're carrying extra weight around your middle. It is simple but reliable. Feeling tired and sluggish after meals. Craving sugar or carbs, especially in the afternoon or the evening. Struggling to lose weight even when you're doing everything right. Having high blood pressure, high cholesterol or borderline blood sugar. The other is, of course, having actually a family history of type 2 diabetes, heart disease or strokes. If any of those sound familiar, you might be somewhere on that curve. And I want you to know, it's not your fault. A family history of type 2 diabetes, heart disease or strokes. If any of these sound familiar, you might be somewhere on that curve. And I want you to know it's not your fault. A modern environment full of processed food, stress and lack of movement makes insulin resistance almost inevitable for many people. But the good news is you can absolutely do something about it. Let's think about your health like a car. Imagine you're driving along and suddenly a warning light pops up. Maybe it's the engine oil, tyre pressure, the light. It's so easy to feel annoyed, isn't it? Or even tempted to ignore it, especially if the car seems to be okay, it's running fine. But deep down, that light isn't the real problem. It's just a signal, a message from under the bonnet that something in the car needs your attention. And yes, you could ignore it, to put a bit of tape over the light or reset the dashboard so it turns off, but that doesn't fix what's really going on. The smart thing to do, of course, is to lift the bonnet or get somebody who knows to see what's causing the warning in the first place. And your waist measurement is a bit like that warning light. It's a visible early sign that something inside, often insulin resistance, is starting to build up. Even if you feel fine or your blood sugar tests are normal, a growing waistline is your body's way of flashing that warning light, letting you know there's something upstream that deserves your attention. Instead of just covering up the light, treating the symptoms with tablets or quick fixes, it's much more powerful to check underneath that bonnet, to look at what's driving the change in the first place. And that's why I encourage you to grab a tape measure, check your waist. It's a simple, practical way to spot early signs long before anything else might show up. So go and grab a tape measure. If you have one in the house, find the gap between your hip bone and the bottom of your wrist, your waist. It's roughly halfway between those 2 points. Breathe out naturally, wrap the tape measure around and find what your reading is. And if you use the NHS guidelines to interpret that, for women, your low risk is less than 80 centimetres or about 31.5 inches. The amber area, the increased risk, is 80 to 87.9 centimetres or 31.5 to 34.5 inches. And the high risk, or the red warning, is 88 centimetres and above, which is more than 34.6 inches. For men, the low risk is less than 94 centimetres, 37 inches. The amber zone, increased risk, is between 94 to 102 centimetres, or 37 to 40 inches. And the high risk, or the red area, is anything above 102 centimetres or 40.2 inches. So if your waist measurement falls into the amber or red zone, it's a sign that you could be carrying extra fat around your middle, sometimes called the visceral fat. And this is what's linked to insulin resistance. So a simple test, but a very effective one. Now remember, this isn't about blaming or shaming anybody. It's simply a tool, a quick check-in with your body to help you understand where you might be on that health and disease curve. Even if your weight is normal on the scales, carrying extra weight around your waist can be an early warning sign that your body is starting to struggle. So as you watch this, take a note of those waist measurements. Are you in the green, amber or red zone? Because this number will tell you a lot about what's happening inside. No blood test needed. If you want to learn more about this topic and steps you can take to reverse down that line, then I've got a brilliant little series of videos on my website. Click the link underneath because I've had such great reviews about this video series. It's free and it'll help you understand the first steps to start reversing insulin resistance. Remember, this is not about perfection or panic. It's about understanding. The more you know, the more control you have over your own health journey. Thank you for listening.